The very first step towards making conversion therapy illegal was to remove homosexuality from the list of mental disorders, which was done by the American Psychiatrists Association in 1973. 1 year before, something pivotal happened, involving one man at one event that would change the way homosexuality was to be dealt with. Dr. John E. Fryer, a gay psychiatrist, appeared in a mask before his colleagues at a convention to announce his homosexuality. He needed to remain anonymous, as revealing his identity would have cost him his job. Not only that, but at the time, before it was delisted as a mental illness, treatment for homosexuality included chemical castration, electric shock therapy, mental institutionalization, and lobotomies. That's why he presented himself as Dr. Anonymous, wearing a mask, a wig, and he even used a voice-distorting microphone to address the association's meeting. He went on to explain that he had suffered from discrimination. Indeed, he was terminated from his psychiatry residency program at the University of Pennsylvania School of Medicine in the 1960s when it was discovered that he was gay, and he had to complete his residency elsewhere, hiding this aspect of his identity. Because of this speech and the following removal of homosexuality from the list of mental illnesses, he paved the way to end dealing with it as a disease and thus contributed to banning conversion therapy. Today, there is no medical protocol attached to diagnosing homosexuality because it cannot be considered as an illness or a mental disorder, and it would be unprofessional or even criminal coming from a healthcare worker to label homosexuality as something that needs to be cured. The mental care provided to people who discover their homosexuality is related to the mental stress or sometimes depression that comes from being rejected or finding it difficult to accept one's differences. We have to thank Dr. John E. Fryer for speaking up and finding the courage to confront his colleagues and a medical view on the matter at the time, making it possible to end a malpractice with long-lasting impact on the well-being of those who were its targets, but also on our society's perspective regarding norms and expectations toward those who cannot conform to arbitrary cultural standards.